This will now come to order. The clerk will please call the roll.
Chair Frank,
Here.
Vice Chair Rose,
Here.
Representative Click,
Here.
Representative Shaheen,
Here.
Representative Ramos,
Here.
Representative Noble,
Here.
Representative Campos,
Here.
Representative Hall, Representative Manuel.
Here.
A quorum is present. Members, today we're going to take up pending business and hear new House bills and take public testimony. In fact, we've got a lot of voting to do here at the start. A reminder to those in the audience wishing to testify on the bills listed on the agenda, you need to fill out a witness affirmation form. Please do this at the witness registration kiosk outside the hearing room, or if you need assistance, you can approach our Assistant Clerk, Blake Albright, to help with registration. You can also speak to him if you require the use of a translator or have a disability for which you need assistance. If you've already registered and wish to change your position, please let us know when you're called to speak, or please see the Assistant Clerk. Please try not to register twice. The testimony will be limited to 3 minutes. There's a timer up here. When the light turns yellow, you have 30 seconds remaining. When the light turns red, please wrap it up so members can ask questions. Please also don't feel the need to use your full 3 minutes. The testimony, if you have any handouts that you wish to distribute, please give them to the Assistant Clerk at the desk, and he will distribute it to the members. Members, any questions or comments? Seeing none, we will begin with pending business. And members, there's some of these we're going to try to send to local and consent, but I don't have a perfect vote count on all of them. If I mention local and consent, I'm going to look up. If you're a no, just give me a funny look and I'll back up, which is fine, no problem. All right, the chair lays out. House Bill 423 is pending business by Representative Lopez. Members, we heard this bill in early March. HB 423 relates to a study regarding the cost of child care in the state in comparison to wages. Vice Chair Rose offers a committee substitute. The committee substitute only instructs the Texas Workforce Commission, whereas previous language includes both HHSC and the Texas Workforce Commission. It also compares the cost of child care to family income rather than to wages. Is there objection to the adoption of the committee substitute? The chair hears none, and the substitute is adopted. Vice Chair Rose moves that House Bill 423 as substitute be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Aye.
Representative Click,
Nay.
Representative Shaheen,
Nay.
Representative Ramos,
Aye.
Representative Noble,
Nay.
Representative Campos,
Yes.
Representative Hall,
No.
Representative Manuel.
There being 5 ayes and 4 nays, the motion prevails. And Chair recognizes Representative Hull as present. Obviously, she was present before the vote, so that's not going to cause problems. The chair lays out House Bill 795 is pending business by Representative Ed Thompson. Members, we heard this bill in committee 2 weeks. Actually, was it 2 weeks ago? Okay, 2 weeks ago. House Bill 795 relates to emergency generators or other power sources for nursing facilities and assisted living facilities. Representative Campos offers a committee substitute. The committee substitute requires assisted living facilities to have in place either an emergency generator or backup power on the facility's premises with enough fuel to power the generator not less than 24 hours, or an agreement to receive backup power or generator equipment in a manually operated transfer switch to power designated emergency areas. Is there objection to the adoption of the committee substitute? The chair is none, and the substitute is adopted. I will say I don't know that anybody has worked on a bill more than this. Doesn't make it a perfect bill, but he has worked on it very hard with all stakeholders. So, Representative Campos moves that House Bill 795 as substituted be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Nay.
Representative Click,
Nay.
Representative Shaheen,
Whoa.
Representative Ramos,
Nay.
Representative Noble,
Nay.
Representative Campos,
Yes.
Representative Hall,
Yes.
Representative Manuel.
Yes.
Okay, with 4 ayes and 5 nays, the motion fails. The chair lays out. We're getting off to a quick start. All right. The chair lays out House Bill 1289 is pending business by Representative Campos. Members, we heard this bill in committee last week. HB 1289 relates to a training program for persons investigating suspected child abuse or neglect. Representative Ramos offers a committee substitute. The committee substitute provides a minor change to the techniques and protocols for interviewing alleged abusers by removing the term forensic. Is there objection to the adoption of the committee substitute? The chair hears none. And the substitute is adopted. Representative Ramos moves that House Bill 1289 as substitute be reported favorably to the full House with the recommendation that it do pass and be printed. Clerk will please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Aye.
Representative Click,
Aye.
Representative Shaheen,
Aye.
Representative Ramos,
Aye.
Representative Noble,
Aye.
Representative Campos,
Aye.
Representative Hull,
No.
Representative Manuel.
Aye.
There being 8 ayes and 1 nay, the motion prevails. I've never quite heard a no like that. That's what happens when you vote no and you're sitting next to the person, so it's pretty awesome. We have fun in this committee, even in votes, so. The chair lays out House Bill 1667 is pending business by Representative Chatan. Members, we heard this bill in committee last week. HB 1667 relates to the reporting of child abuse or neglect. Representative Shaheen offers a committee substitute. The committee substitute clarifies matters to be reported to DFPS as concerning for abuse and neglect. It also requires professionals who are mandated reporters to receive training that includes matters to be reported to DFPS as abuse or neglect, alternatives to reporting, and matters that may be referred to a community-based prevention or family preservation service provider, and the proper procedures for making a report of concerns regarding abuse or neglect to DFPS. Is there an objection to the adoption of the committee substitute? The chair is none, and substitute is adopted. Representative Shaheen moves that House Bill 1667 as substituted be reported favorably to the full House with the recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
No.
Representative Click,
Aye.
Representative Shaheen,
Aye.
Representative Ramos, yes, Representative Noble,
Aye.
Representative Campos,
Aye.
Representative Hull,
Aye.
Representative Manuel,
Aye.
Representative Ramos.
No.
There being 7 ayes and 2 nays, the motion prevails. The chair lays out House Bill 1879 as pending business by Representative Darby. Members, we heard this bill in committee a few weeks ago. House Bill 1879 relates to the provision of counseling service by certain providers under Medicaid and reimbursement for those services. Representative Noble offers committee substitute. This committee substitute provides a technical clarification regarding licensed clinical social workers. It also adds language to make licensed marriage and family therapist associates working towards fulfilling supervised practice requirements eligible for reimbursement under Medicaid, and incorporates language to ensure that federally qualified healthcare centers that provide counseling services are also eligible to be reimbursed. Is there objection? Excuse me. Is there objection to the adoption of the committee substitute? The chair hears none, and substitute is adopted. Representative Noble moves that House Bill 1879 as substitute be reported favorably to full House with the recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Aye.
Representative Click,
Aye.
Representative Shaheen,
No.
Representative Ramos,
Aye.
Representative Noble,
Aye.
Representative Campos,
Aye.
Representative Hull,
No.
Representative Manuel.
Aye.
There being 7 ayes and 2 nays, the motion prevails. Chair lays out House Bill 2401 as pending business by Representative Oliverson. Members, we heard this bill in committee 2 weeks ago. HB 2401 relates to the repeal of certain contracting requirements under the Medicaid managed care delivery model, the mandatory contracting. Representative Shaheen offers a committee substitute. The committee substitute specifies that the act will apply to a contract that is fully executed by the effective date. Is there objection to the adoption of the committee substitute? The chair hears none, and the substitute is adopted. Representative Shaheen moves that House Bill 2401 as substituted be reported favorably to the full House with a recommendation that do pass and be printed. Clerk will call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
No.
Representative Click,
Aye.
Representative Shaheen,
Aye.
Representative Ramos,
No.
Representative Noble,
Aye.
Representative Campos,
No.
Representative Hull,
Aye.
Representative Manuel.
Aye.
There being 6 ayes and 3 nays, the motion prevails.
The halls.
It is not done yet. So there's work to be done still. So next step, yeah, and that is it is understood. One step in the process. The chair lays out House Bill 2572 as pending business by Representative Lujan. Members, we heard this bill in committee a few weeks ago. HB 2572 relates to the Central Registry of Names of individuals found to have abused or neglected a child. Representative Manuel moves that House Bill 2572 without amendment be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank?
Aye.
Vice Chair Rose?
Aye.
Representative Click?
Aye.
Representative Shaheen?
Aye.
Representative Ramos?
Aye.
Representative Noble?
Aye.
Representative Campos?
Aye.
Representative Hull?
No.
Representative Manuel?
There being 8 ayes and 1 nay, the motion prevails. Chair lays out House Bill 2933 as pending business by Representative DeRazio. Members, we heard this bill in committee last week. House Bill 2933 relates to ensuring certain adoptive parents may consent to medical care and access information regarding their child who is eligible for benefits under Medicaid. Vice Chair Rose moves that House Bill 2933 without amendment be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank?
Aye.
Vice Chair Rose?
Aye.
Representative Click?
Aye.
Representative Shaheen?
Aye.
Representative Ramos?
Aye.
Representative Noble?
Aye.
Representative Campos?
Aye.
Representative Hull?
Aye.
Representative Manuel?
Aye.
Wow. There being 9 ayes and 0 nays, the motion prevails.
We all agree today.
It's easy stuff. Easy stuff. The chair lays out House Bill 3119 as pending business by Representative Smithy. Members, we heard this bill in committee last week. House Bill 3119 relates to the requirements applicable to certain third-party health insurers in relation to Medicaid. Representative Hull offers committee substitute. The committee substitute updates state statutes regarding third-party liability to reflect these changes in federal law. Is there objection to the adoption of the committee substitute? The chair hears none, and substitute is adopted. Representative Campos moves that House Bill 3119 as substitute be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank?
Aye.
Vice Chair Rose?
Aye.
Representative Click?
Aye.
Representative Shaheen?
Aye.
Representative Ramos?
Aye.
Representative Noble?
Aye.
Representative Campos?
Aye.
Representative Hull?
Aye.
Representative Manuel?
Aye.
There being 9 ayes and 0 nays, the motion prevails. On a roll. I was afraid to use local and consent, but I may be getting better now. The chair lays out House Bill 3265 as pending business by Representative Manuel. Members, we heard this bill in committee last week. House Bill 3265 relates to the submission of certain reports by Health and Human Services Commission. Representative Click moves that House Bill 3265 without amendment be reported favorably
And sent to the local.
and sent to the Committee on Local and Consent Calendars. No, I don't think we should do that. Backup members, Representative Click moves that House Bill 3265 without amendment be reported favorably to the full House with a recommendation.
He's changing his mind.
My votes are correct, yes. Go to local then.
All right,
Go bold or go home.
members, if I,
Yeah, let's do it.
if I go to local and consent, is anybody looking up at me? Okay,
Run with it.
run with it. I hope I hadn't messed up the, it's like this is my first time or something, sorry.
It's mine.
Wait.
Representative Click moves that House Bill 3265 without amendment be reported favorably to the full House with a recommendation that do pass and be sent to the Committee on Local and Consent Calendars. Clerk will please call the roll.
Chair Frank?
Aye.
Vice Chair Rose?
Aye.
Representative Click?
Everybody's got.
Representative Shaheen? Representative Ramos?
Aye.
Representative Noble?
Aye.
Representative Campos? Representative Hull?
Aye.
Representative Manuel?
Definitely.
Representative Shaheen?
Can I talk to you about one of my bills?
Anytime.
Just keep it, by the way.
All right, that's it.
There being 9 ayes and 0 nays, the motion prevails. All right, we're gonna have to
Sorry.
calm down a little bit. We got members here waiting to lay out bills. All right. Chair lays out House Bill 3329 as pending business by Representative Thimish. Members, we heard this bill in committee 2 weeks ago. House Bill 3329 relates to the investigation or determination of abuse or neglect of a child, elderly person, or a person with a disability and the provision of certain services. Representative Click offers committee substitute. Committee substitute ensures that the bill does not inadvertently direct the department, specifically APS, to provide services they do not already provide. It also states that DFPS cannot also delay investigations or begin providing such services based solely on the fact that the elderly person or persons with a disability is temporarily hospitalized. Is there objection to the adoption of the committee substitute? The chair is none. The substitute is adopted. Representative Click moves that House Bill 3329 as substitute be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank?
Aye.
Vice Chair Rose?
Aye.
Representative Click?
Aye.
Representative Shaheen?
Aye.
Representative Ramos?
Aye.
Representative Noble?
Aye.
Representative Campos?
Aye.
Representative Hull?
No.
Representative Manuel?
There being 8 ayes and 1 nay, the motion prevails. Chair lays out House Bill 3466 as pending business by Representative Campos. Members, we heard this bill in committee 2 weeks ago. House Bill 3466 relates to the administration of a grant program for the establishment and expansion of community collaboratives. Representative Manuel moves that House Bill 3466 without amendment be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank?
Aye.
Vice Chair Rose?
Aye.
Representative Click?
Aye.
Representative Shaheen?
No.
Representative Ramos?
Aye.
Representative Noble?
Aye.
Representative Campos?
Aye.
Representative Hull? Representative Manuel? Representative Hull?
Aye.
There being 8 ayes and 1 nay, the motion prevails. The chair lays out House Bill 3550 as pending business by Vice Chair Rose. Members, we heard this bill in committee 2 weeks ago. House Bill 3550 relates to standards for and services provided by prescribed pediatric extended care centers. Representative Campos moves that House Bill 3550 without amendment be reported favorably to the full House with a recommendation that it do pass and be printed. Clerk, please call the roll.
Chair Frank?
Aye.
Vice Chair Rose?
Aye.
Representative Click?
Aye.
Representative Shaheen?
No.
Representative Ramos?
Aye.
Representative Noble?
Aye.
Representative Campos?
Aye.
Representative Hull? Representative Manuel?
There being 7 ayes and 2 nays, the motion prevails. Chair lays out House Bill 4075 as pending business by Representative Romero. Members, we heard this bill in committee last week. House Bill 4075 relates to the regulation of certain occupations by the Texas Behavioral Health Executive Council, authorizing fees. Vice Chair Rose moves that House Bill 4075 without amendment be reported favorably to full House with a recommendation that do pass and be printed. Clerk will please call the roll.
Chair Frank?
Aye.
Vice Chair Rose?
Aye.
Representative Click?
Aye.
Representative Shaheen?
Yes.
Representative Ramos?
Aye.
Representative Noble?
Aye.
Representative Campos?
Yes.
Representative Hull?
Aye.
Representative Manuel?
There being 9 ayes and 0 nays, the motion prevails. The chair lays out House Bill 4170 as pending business. Members, we heard this bill in committee last week. House Bill 4170, I'm assisted by Representative Campos, if I didn't say that. House Bill 4170 relates to the enforcement actions taken against a child care or child placing agency administrator's license. Representative Ramos moves that House Bill 4170 without amendment be reported favorably to the full House with a recommendation that do pass and be printed. Is this local link consent? That it do pass and be printed and reported to the committee on local and consent calendars. Clerk will please call the roll.
Chair Frank?
Aye.
Vice Chair Rose?
Aye.
Representative Click?
Aye.
Representative Shaheen? Representative Ramos?
Aye.
Representative Noble?
Aye.
Representative Campos?
Aye.
Representative Hull?
Aye.
Representative Manuel?
Look at us. There being 9 ayes and 0 nays, the motion prevails. Chair lays out House Bill 4351 as pending business by Representative Noble. Members, we heard this bill in committee last week. House Bill 4351 relates to the training program required for certain employees of the Department of Family and Protective Services. Representative Click offers committee substitute. This committee substitute states that caseworkers in training are under the direct supervision of a trainer when initiating an investigation or providing protective services. Is there objection to the adoption of the committee substitute? The chair is none, and substitute is adopted. Representative Click moves that House Bill 4351 as substituted be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank?
Aye.
Vice Chair Rose?
Aye.
Representative Click?
Aye.
Representative Shaheen?
Aye.
Representative Ramos?
Aye.
Representative Noble?
Aye.
Representative Campos,
Aye.
Representative Hull, Representative Manuel.
There being 9 ayes and 0 nays, the motion prevails. The chair lays out House Bill 4629 is pending business by Representative Click. Chair Click, members, we had this bill in committee last week. House Bill 4629 relates to the terms and qualifications of members on the Intellectual and Developmental Disability System Redesign Advisory Council. Representative Noble moves that House Bill 4629 without amendment be reported favorably to the full House with a recommendation that do pass and be printed. Is this a local and consent, members?
No.
No. That it do pass and be printed. I'm sorry. Sorry. And that it do pass and be printed and sent to the Committee on Local and Consent Calendars. Clerk will please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Aye.
Representative Click,
Aye.
Representative Shaheen,
Aye.
Representative Ramos,
Aye.
Representative Noble,
Aye.
Representative Campos,
Aye.
Representative Hull, Representative Manuel.
There being 9 ayes and 0 nays, the motion prevails. Chair lays out House Bill 4696 as pending business by Representative Noble. Members, we had this bill in committee last week. House Bill 4696 relates to transferring certain investigations of abuse, neglect, and exploitation to the Health and Human Services Commission and the on-site investigation and survey of certain providers by the Health and Human Services Commission. Representative Hull offers a committee substitute. The committee substitute cleans up additional sections of code to clarify that HHSC, not DFPS, conducts abuse and neglect investigations in long-term care settings. It also clarifies various other duties of HHSC, not DFPS. Is there objection to the adoption of the committee substitute? The chair is none, and the substitute is adopted. Representative Hull moves that House Bill 4696 as substitute be reported favorably to the full House with a recommendation that do pass and be printed. Clerk will please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Aye.
Representative Click,
Aye.
Representative Shaheen,
Aye.
Representative Ramos,
Aye.
Representative Noble,
Aye.
Representative Campos,
Aye.
Representative Hull,
Aye.
Representative Manuel.
There being 9 ayes and 0 nays, the motion prevails. All right, we've got 2 more. The chair lays out Senate Bill 780 by Senator Hughes, the companion to House Bill 210. Who that was by? Okay, members, this referred Senate bill is the companion for House Bill 210 or 2010, which was heard in committee 2 weeks ago, related to emergency possession of certain abandoned children by designated emergency infant care providers. That was Representative Hefner. Sorry. The chair moves that Senate Bill 780 without amendment be reported favorably to the full House with a recommendation that do pass and be printed. Clerk, please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Aye.
Representative Click,
Aye.
Representative Shaheen,
Aye.
Representative Ramos,
Nay.
Representative Noble,
Aye.
Representative Campos,
Aye.
Representative Hull,
Aye.
Representative Manuel.
What'd he say? He said, there being 8 ayes and 1 nay, the motion prevails. And last but not least, the chair lays out Senate Bill 1325 by Alvarado, the companion to House Bill 2229 by Goodwin. Members, this referred Senate bill is the companion for House Bill 2229, which we heard in committee last month, related to the notice given to certain victims of family violence, stalking, harassment, and terroristic threats. We previously voted out House Bill 2229 unanimously to the local and consent calendar. The chair moves that Senate Bill 1325 without amendment be reported favorably to the full House with the recommendation that it do pass and be printed and sent to the committee on local and consent calendars as well. Clerk will please call the roll.
Chair Frank,
Aye.
Vice Chair Rose,
Aye.
Representative Click,
Aye.
Representative Shaheen,
Aye.
Representative Ramos,
Aye.
Representative Noble,
Aye.
Representative Campos,
Aye.
Representative Hull,
Aye.
Representative Manuel.
There being 9 ayes and 1 nay, there being 9 ayes, there's no one left, and 0 nays, the motion prevails. All right.
Do you want to do 4233 right now?
Which one?
Do you want to do 4233 right now?
Yeah. There was one bill I didn't get a committee sub, a ledge council sub that was on your list. We'll vote that out after lunch as soon as we get it. I want to get the script ready and that kind of stuff. And we also have some members that are patiently waiting to lay out bills. What's that?
Just go.
Okay. The chair lays out House Bill 1796 and recognizes Representative Howard to explain her bill. The patient Representative Howard. And the chair does offer up a committee substitute for House Bill 1796 as well.
Thank you, Chairman Frank and Vice Chair Rose and members for the opportunity to lay out House Bill 1796. The committee substitute it was basically a technical cleanup, replacing language that had been inadvertently omitted in the drafting, moving things around, that sort of thing. No substantive change, really. The statute that outlines required services for family violence centers statewide and directs the minimum contract requirements for family violence centers has not been updated in over 20 years. During that time, best practices when working with survivors of domestic violence and their families have evolved and changed. We now have a better understanding of what is needed when working with these families and how to best serve them. HB 1796 simply updates Chapter 51 of the Human Resources Code to include safety planning, counseling, peer support, and prevention efforts. These are all services that family violence centers and survivors have cited as necessary components to the healing process. In fact, over the course of a few years, the Texas Council on Family Violence has met with nearly 100 family violence survivors and advocates to determine the changes that HB 1796 proposes. And I will mention that HHSC has also been involved with determining these changes. Chapter 51 serves as the enabling statute for family violence centers and sets the list of services that HHSC-funded family violence centers are required to provide, as the current statute no longer fully encompasses the needs of victims who are seeking help and safety from a family violence center. HB 1796 is about ensuring the baseline for statewide family violence services is reflective of current best practices and fully encompasses the needs of victims who are seeking help and safety from a family violence center. Happy to answer any questions and reserve the right to close.
All right, and you will certainly have that, members. Any questions?
Thank you,
All
Mr.
right,
Chair.
thank you. Chair calls Jen Mudge. I'm sorry, Jen Mudge with the Texas Council on Family Violence. And then I've got Andrea, just a little, Malzenberger, as the only other person showing one. No, I'm sorry. Actually, and then Kara Mendeljohn. I'm sure I'm getting that wrong. Ma'am, I have you as Jen Mudge with the Texas Council on Family Violence for the bill. Is that correct?
Yes, that's correct.
All right, thanks.
All right. Good morning. My name is Jen Mudge. I'm here representing the Texas Council on Family Violence, and I'm here to testify in strong support of HB 1796. Thank you, Chair Frank and Vice Chair Rose, and to the committee members for your time. And thank you, Representative Howard, for your leadership in authoring this bill and your longstanding support of survivors in our state. This is a bill that family violence centers all over the state are excited to see become law. In fact, in the written testimony packets, you'll see letters from family violence centers in most of your districts showing their support for this bill. As Representative Howard laid out, this bill seeks to update Chapter 51 of the Human Resources Code, which lists the services that family violence centers are required to provide. And as she mentioned, this hasn't been updated in over 20 years, and key changes are needed to better support survivors' safety and well-being. She also mentioned the research that was done leading up to this, the drafting of this bill. So years of planning and research were led to this update. In conjunction with the Health and Human Services Family Violence Program and a research team, a study was conducted with nearly 100 advocates and 100 victims who offered their input. And what that research found is that some of the services that are most important to survivors are counseling, economic advocacy, advocacy for children, and peer support services. And while these services are offered in many programs, surprisingly, none of them are in Chapter 51. And I can say from my own experience as an advocate, as a therapist, and now in my role with the statewide Domestic Violence Coalition, I've seen the healing and empowerment that's possible when survivors are able to utilize these services. The research also showed that an advocacy service model that's trauma-informed and voluntary is critical to support these services. This model will create consistency for survivors when they take that courageous step to reach out for help. So whether they're living in a small rural community or a large metroplex, updating Chapter 51 to center on trauma-informed services is crucial so that every survivor can access the help that they need. In closing, we appreciate the committee substitute that clarifies the difference between urgent crisis services and advocacy services, as well as other conforming changes. And I'd just like to thank you for your time, and I'd urge you to stand with your constituents to help create more safety and healing for survivors in our state. I'm happy to take any questions.
Okay, thank you. Members, any questions? Okay, just quickly, what does it mean culturally relevant? What does that look like in practice?
So there's a lot of, it can mean a lot of different things. And it is
I
something
agree.
that's not currently in the bill, but
I'm sorry?
it's not currently in the committee substitute. That was,
We have the committee substitute laid out for us. So we're talking about the committee substitute.
It's in there.
It's in there, meaning I think it's in the bill we have before us.
it's in, yes, it's in the bill, but I believe it was removed in the committee substitute.
Okay, this is a sub.
No, I see it too. It's on page 1, line 10 and 11.
I do have
Okay,
a
so
copy.
you think it is removed from
Yeah,
the
I have a
committee
copy
sub?
here if you'd like to.
Okay, I'm sorry. I may have looked at the wrong thing. You are correct, it is not. I don't see it on the committee sub. Okay,
Yeah.
sorry. And then the trauma-informed care, cool with trauma-informed care, it's not any particular model of trauma-informed care, correct?
Right,
Not a registered, trademarked, that has been an issue before, so,
No.
okay, very good.
Yeah.
Thank you very much. Members, any other questions? All right, thank you very much for your testimony. Appreciate the work on this. Chair calls Andrea Maltzberger. And then I show Kara Mendelson, sorry. Got to get new contacts. I show you is Audria Maltzberger, self for the bill, is that correct?
Sir.
All right, thank you. Go ahead.
Good morning, and thank you for having me here today. My name is Audria Maltzberger, and I'm here in support of HB 1796 as both a survivor of domestic violence and a constituent of Representative Click. Thank you, Representative Howard, for your leadership in authoring this bill and for your support for domestic violence victims. I was in a relationship that lasted 12 and a half years, and in the end, it took broken bones for me to leave. When I finally found the strength to leave, I left with my 3 children, a laundry basket of clothes, and my car. From South Texas, I drove more than 8 hours to Fort Worth and found safety at Safe Haven of Tarrant County's emergency shelter. Safe Haven offered an umbrella of services needed for us to put our lives back together. Upon arriving at the shelter, they immediately helped me establish an emergency protective order. Safe Haven was not only a place of refuge, but they also fed us, clothed us, provided individual, family, and group counseling while in the shelter, and continued long after we transitioned into housing. They shared information with me about domestic violence, abuse, healthy self-esteem, and safety planning. They communicated with my family and walked with me through the process of obtaining housing. Through their services, I was able to build my resume, establish employment, and provide for myself and my children. It took years for me and my children to recover from the effects of domestic violence. The support we received individually and as a family changed the trajectory of our lives. My youngest son graduated in the top 2% of his class and received a full ride scholarship to a top 10 elite university. My oldest son is self-employed and a homeowner. My daughter has grown up to be an advocate for others and is going to college to be a social worker. I'm happily remarried to an incredible man, and we're proof that there's life after abuse. In the past 5 years, I've shared my story in my community, schools, and colleges to help raise awareness about domestic violence. and I use my voice to empower others to live a life free from abuse. I'm proud to say that I now have the honor of serving on the board of directors at Safe Haven and believe in their vision to end family violence. I thank God for the services that my children and I received through Safe Haven, and I can't imagine where our lives would be without them. I pray that these services would be offered statewide through HB 1796 and that every survivor would have access to the same life-changing services we received. Thank you so much for your time. I would also like to mention that as a survivor, having access to multiple services proposed as additions in this bill will help so many other survivors in Texas lead safer and more empowered lives. I humbly ask that you vote HB 1796 favorably out of committee. Thank you. I'd be happy to answer any questions.
Thank you very much. Very, very encouraging. Obviously, there's challenges, but it's fun to hear stuff from the other side. So congratulations on where you are in your family. Members, any other questions
Thank
or any
you.
questions? Yes, Representative Manuel. Just one more question.
I just wanted to say thank you for sharing your story and thank you for being here.
I
And
appreciate
I'm
it.
happy that you're here. Thank you.
Thank you. It's an honor to be here and to represent survivors.
Thank you. Members, any other questions? All right, thank you. Chair calls Kara Mendelson. And I show nobody else wishing to testify on the bill. If you do, please get registered. I show you as Kara Mendelson, self for the bill. Is that correct?
For the city of Dallas.
Oh, okay. Do we have your permission to change and show you representing the city of Dallas?
Correct.
Okay.
Well, thank you, Chairman Frank.
And yourself?
And myself.
And yourself. Okay, thank you. Go ahead.
Good morning. Thank you, Chairman Frank and committee members. My name is Kara Mendelson. I'm a Dallas City Council member, and I chair the Budget Committee. I'm the vice chair of the Public Safety Committee, and I'm a member of the Legislative Ad Hoc. Family violence correlates with many negative outcomes for victims. Children who witness family violence are at increased risk of substance abuse, PTSD, aggressive behavior, anxiety, academic issues, and more. In Dallas in 2023, there have been 3,932 reported family violence crimes so far. Dallas County reports 458 felony family violence cases received year to date, and there have been 4 intimate partner deaths in Dallas this year. Education levels, age, family income, and ethnicity are all risk factors for both sexual abuse and physical abuse. Understanding where a victim comes from and their history is a crucial part of providing the most effective services. HB 1796 sets the standard for family violence services and includes culturally relevant and trauma-informed services that include intervention services related to economic stability, mental health, and community education tailored to the situation that victims find themselves in. The bill will strengthen services for Texans of all linguistic and cultural backgrounds. 45 million children grow up exposed to violence within their family, according to domestic violence researchers published by the National Institute of Health. Family violence correlates strongly with outcomes for the children who witness it. Children who witness domestic violence are at increased risk for post-traumatic stress disorder, aggressive behavior, anxiety, impaired development, difficulty interacting with peers, academic problems, and they have a higher incidence of substance abuse. Thank you for supporting this bill, and if there's any questions, I'm happy to answer.
Okay, and thank you for your work with the City of Dallas. Members, any questions? Vice Chair Rose.
I left my wand today.
Oh, that's terrible.
Councilmember Mendelson is so glad to see you here today, and we really appreciate your testimony. And you stated in your testimony that ethnicity was one of the risk factors. Could you kind of elaborate on that a little bit?
Well, when you start doing the demographics, you do see that that people of color have a higher incidence.
Okay.
So,
Oh, I'm not disagreeing with it. I was just
yeah, we want to make sure
a
everybody's
comment.
taken care of.
Yeah. Okay. Well, thank you
Appreciate
again.
your
It's
support
great.
as always.
Oh, absolutely. Great seeing you too. All right. Thank you, Mr. Chairman.
You're welcome. Members, any other questions? All right, thank you very much. At this time, there are no other witnesses signed up to testify. Is there anyone else wishing to testify on, for, or against House Bill 1796? Seeing none, public testimony is closed, and the chair recognizes Representative Howard to close on HB 1796.
Thank you, Mr. Chair and members. Really, this is just about bringing this up to date, making sure, and many of these facilities are already doing this, but this is to ensure that all facilities in the state are providing the best practices as they appear right now to get the funding for the programs. So if there's any other questions, I'm happy to try to answer them.
Okay, members, any other questions?
Otherwise, I close. Thank you
All
so
right,
much.
thank you. The committee substitute is withdrawn. If there's no objection, the bill will be left pending. The chair hears none, and House Bill 1796 is left pending without objection. So we're going to stand at ease for just a minute. And just for those of y'all, we're going to do the two GARA bills, and then I'm going to do the compost bill, 4905, because I want to give the commissioner an opportunity to testify, and she has some places to be this afternoon. So, and then we will keep going in seniority order, but I'm going to pull the compost bill out of order just for those of y'all paying attention at home. Chair, right here. Chair lays out House Bill 5021 and recognizes Representative GARA to explain his bill.
Chairman and members, good morning, and thank you for allowing me to lay out House Bill 5021. I would like to give some background and context to this legislation. The Texas Health and Human Services Commission awards thousands of contracts for goods and services each year that are literally worth billions of dollars. Contract transparency is a key government responsibility dictated by the state's procurement laws. Texas taxpayers demand to know how the state spends their hard-earned money. In fact, the State of Texas Procurement and Contract Management Guide is 274 pages thick. 274 pages thick is how seriously the state of Texas, and we take contract management here in Texas. And I think I have a staffer here that will hold that book up because it's kind of heavy. We have strict rules, and we have them for a reason. These transparency requirements are in place to prevent waste, fraud, and abuse. I think we can all agree taxpayers deserve a transparent government, but there is an oversight that is preventing complete transparency in HHSC contracting. Vendors who earn HHSC's contracts are not subject to the same strict transparency and competitive bidding requirements as the original contractor when the vendor hires a subcontractor. And that is when the vendor hires a subcontractor. For example, the HHSC could award a contract for providing substance use disorder treatment for youth to a particular vendor, following all the transparency and procurement rules. But then the vendor, let's call him Mr. X, hires subcontractors to provide the treatment. And instead of competitively bidding for those subcontracts, he gives his best friend, just as an example, a contract, such as his uncle, such as some friend of his, and even Mrs. X, a contract. I know that is simplified, but you get the point. Taxpaying Texans deserve to know how their money is spent from start to finish, from vendor to every subcontractor. HB 5021 aims to increase subcontractor transparency at HHSC It's just another tool in our transparency for Texas tool belts. I don't want to dwell on the past, but we all know HHSC has struggled in the past with contracting. This bill would strengthen the public's belief that HHSC is back on track. Texans deserve to know how HHSC subcontractors are using their taxpayer dollars. My bill will do this by making public the process a contractor uses to select subcontractors, the number and the names of subcontractors submitting a bid to the contractor, and the reasons why the contractor chose that particular subcontractor. I have received concerns from some of the health plans that this would impact their partnering with providers. That is not my intent, and I'm working with HHSC to remedy this concern. Members, I'm happy to answer any questions. And Chairman, I respectfully request the right to close.
All right, thank you. You certainly have that. Members, any questions? I was kind of trying to figure out, because I love transparency also. At the same time, I would assume in most of these cases, it is a fixed contract that we have between the state and the prime contractor. Is that right?
Well, between the state, yeah.
So,
Correct.
and so if I have a fixed dollar amount from in the first contract, trying to figure out why it would seem to almost add extra paperwork for no real reason. Do I care whether or not the person does it themselves or does it to a third party? I'm trying to figure out where that changes what the state pays, because if the first contract's fixed, how does this? Trying to think almost why it matters.
Well, that's exactly correct. But the problem is that thereafter, when a subcontractor is hired, that subcontractor could be hired within the confines that the state has set, could be hired at different amounts. So that's the concern. We just want to bring accountability to the process and to make sure that Texans understand exactly where our money is going. And currently, that's not the case with the way it's set up.
Okay.
Thank you.
All right, thank you. I think we have one person to testify, and I don't know if we have a resource witness.
Yes, we have a resource.
We do have a resource in, okay. Chair, thank you. We'll certainly let you close. Chair calls Kay Garamani, Texas Association of Community Health Plans. I've got you as Kay Garamani, Texas Association of Community Health Plans on the bill. Is that correct?
Yes, that's correct.
All right, thank you.
Hi, good morning. I'm Kate Garamani. I'm the CEO for the Texas Association of Community Health Plans. We are 10 of the 16 health plans on contract with HHSE to do managed care services. And we're not opposed necessarily to the bill, but just wanted to point out that for the managed care companies, the contract is very extensive, and the agency already has a lot of rights around looking into those subcontracts. They, reserve the right to, change or cancel a subcontract if there are issues with the subcontractor being able to carry out the duties. So there's a lot of oversight already over the subcontracts. And also the hub office, the historically underutilized business office, does require that health plans have to report on their subcontracts every month. And if they change their hub plan, then they have to get approval for that. So there is a lot already going on at the agency side. The report will just add to, I guess, the administrative burden of the agency that already has scores of reports that they submit every year.
Okay. Thank you, members. Any other questions? In my reading of it, it's not just the health plans. This is any
Correct.
subcontractor. Y'all are just obviously dealing in very big dollars and whole lots of subcontracting. Is that
correct? Yeah. So I'm just.
But in your subcontracting, trying to think, if you subcontract to an expensive person or a related company, is there a way for that to be more expensive? I'm trying to think of where you can benefit yourself by going to a more expensive subcontractor. Because typically I feel like if it's a fixed fee, but very little of y'all's is fixed fee. Like, if you're building a building, it's one thing, you know, you get $5 million to build this building. Some degree, doesn't matter who you subcontract to, but in your case, I think it may. So, sorry,
I want to make sure I understand your
well,
question.
I don't understand. I'm trying to figure out who it all affects. So you can't answer a question when I don't understand the question. So,
Okay. I should mention that I did hear Representative Guerra say that providers would be exempt, which is great.
okay.
That would really be a problem if providers were included. But
Okay.
there are many contracts that the health plan, subcontracts that they have.
Okay.
So,
Thank you very
all right.
much.
Thank you very much.
We don't, yeah. And I don't think we have a resource witness, so I can get with him after on this. At this time, there are no other witnesses signed up to testify. Is there anyone else wishing to testify on, for, or against House Bill 5021? Seeing none, public testimony is closed, and the chair recognizes Representative Guerra to close on House Bill 5021.
Chairman, members, again, the whole purpose of this is to build in transparency. That's what this is all about. We want to make sure there's no abuse. And people are people, and sometimes they figure out ways to build into the system abuse. We've seen that before in this very instance, but by passing this bill, we'll make sure that we really cut down on anything that's going on. So in that regard, so thank you.
Let me
With
ask you a
that-
question before you close. Don't close. So I appreciate the bill. I really want to try to work with you on it. I sometimes when I look at our procurement process, we do an incredible job of being transparent and adding requirements and requirements and requirements. And with all of those great transparency requirements, it costs twice as much to do business with the state than not. Meaning, like, when I look at whether it's building a building, they cost a lot more. Just people, there's so many people that, because of all the requirements, don't want to deal with us. And so I'm just trying to figure out how to thread that needle. So I look forward to working with you on that. That wasn't really a question. It was more of a statement, because we may not have a chance to talk later. So, members, any other questions? All right.
Chairman, let me just say that, and I've known you a long time, and most of the members here, and we're just, again, looking, make sure we have transparency in the system. We don't want to add any cost to the system. Just want to make sure that everybody's on the up and up. And I think maybe just making sure that we have some of that built into this type of contract that we make sure and cover that base. So with that, Chairman and members, I close.
All right. Thank you very much, Representative. If there's no objection, the bill will be left pending. The chair is none, and House Bill 5021 is left pending without objection.
Thank you. Have a good day.
Don't go anywhere.
Oh, I got it.
The chair lays out House Bill 5023 and recognizes Representative Guerra to explain his bill. Representative Guerra, I understand you have changes to the bill. You can explain the changes. We don't have your committee substitute language. So if you'll talk about the bill, and then obviously any changes you're working on.
Thank you, Chairman, and members, and again for allowing me to lay out House Bill 5023. I would like to give some background and context to this legislation. The purpose of this bill is to increase access to health care for Texans who are already eligible. And again, let me emphasize, already eligible for Medicaid. Medicaid serves a variety of individuals, including low-income children and their families, senior citizens, and people who have disabilities. These individuals lack access to their Medicaid services because there is a shortage of healthcare professionals who accept Medicaid in Texas. So even if you have Medicaid, sometimes you cannot find a doctor to actually treat you. And I know that that's the case in the Rio Grande Valley. See many instances of that. Many rural areas in Texas, including Hidalgo County, which I represent, way down there in tip of Texas, are considered to be medically underserved. The goal of this bill has not changed, but the implementation mechanism has vastly changed from the filed version. The subcommittee, the committee sub, which I'm still working on with legislative counsel, still provides bonuses to Medicaid providers who meet certain criteria. How this happens has drastically changed after conversations with the health care plans and the Health and Human Services Commission. The bonus will not come from the MCOs to the providers. Again, the bonus will not come from the MCOs to the providers. It will come from HHSC to the providers. From the experience rebates, the MCOs return to HHSC. The bonus is no longer designated at 25% of profits. It is at the discretion of HHSC to develop the appropriate amount of total money spent on these bonuses. Instead of focusing on all Medicaid providers, we have narrowed the scope to Medicaid providers who serve mothers and young children ages 0 to 4, medically underserved areas. The HHSC will also determine the criteria for which these bonuses are awarded. These criteria may include how long a Medicaid provider has been a provider, what percentage of their patient load is on Medicaid, or how quickly patients choose to schedule appointments with the provider among the criteria. I just want to get more Medicaid recipients more care. And I know that Medicaid reimbursement rates are one of the major factors why more providers do not accept Medicaid. This bill is a creative way to incentivize more Medicaid providers by providing bonuses to Medicaid providers who perform well. Bonuses work for CEOs. I'm sure they'll work for Medicaid providers as well. Chairman and members, I respectfully request the right to close.
All right, thank you, and you will certainly have it. Members, any questions? All right, thank you. Okay. We do show one person testifying. We do have resource witnesses on this. Chair calls Kay Garamani. I've got you listed as Kay Garamani, Texas Association of Community Health Plans against the bill. Is that correct?
Yes, sir. I'm Kay Garamani with the Texas Association of Community Health Plans. I did register as opposed to the bill. We haven't seen the committee sub yet. I have talked with Representative Guerra's office, and I understand that's forthcoming. We would probably change our vote to neutral once we see the committee sub. But I do want to say that, the agency already requires that over 50% of payments to providers have to be through some alternative payment model. There has to be a hook with quality as well. And so we don't want to see payments going out, bonuses or otherwise, if there's not that quality component linked with it. If the payments are made outside of the managed care companies, CMS could have an issue with that because they typically want for the capitation payment made to the health plans to be payment in full. So that would be something that would have to be checked out with CMS. But in any event, I do want to just make it real clear that the health plans are already doing a lot of bonus payments, a lot of incentive payments to providers. So, those efforts and that innovation is already well underway.
Okay. And that's part of the 50% that you're talking about, the 50% of the payments have to be?
50% of the expended payments, yes, to providers.
And so what do you mean when you say those type of payments, the innovative payments? That's not the word you used.
So alternative
payments.
Yeah,
sorry.
so alternative payment methodologies are really along a continuum, with bonus payments or incentive payments being kind of the first level of alternative payment arrangements. And then the next level is a shared savings. It goes on to shared savings, shared risk, so upside downside payments to providers. And then at the end of the continuum is fully capitated payments, or like a payment per month per member that's served. So that's, and then there's lots of different variations along the way, along that continuum.
Okay. And when you look at providers, have there been any good surveys done to say why providers aren't using Medicaid, or why they're either stepping away or why they don't want to provide Medicaid? Because certainly the reimbursements can be part of it. But I hear all the time it's also the paperwork and the headache of dealing with them. And honestly, I hear that almost more.
I don't
Y'all have
know.
any surveys?
We don't necessarily have surveys. TMA does do surveys of why providers participate or not. I
And
do.
when we talk providers, you're mostly talking doctors, right? Like, because all hospitals are in Medicaid, but hospitals also get huge supplemental payments, whereas
Right.
most doctors don't, right?
Correct.
Or most
Right.
more independent providers don't, and that's really where to me, that's who's getting undercompensated. That fair?
Yes, I think that's fair. And when in 2013 and 2014, all states were required to pay 100% of Medicare to primary care providers and other kinds of physicians. And definitely, there was research and studies that showed that there was greater participation during those 2 years with the increase in reimbursement
Right.
to the Medicare rate. So it is true that reimbursement does.
Oh, absolutely, and I'm not pretending it doesn't. I'm just curious if we've looked at, because I do think it's both. And again, on the Medicaid, on the Medicaid, I think people lose track of there's such a distinction between hospitals and those who get supplemental payments, because you get paid, 67, 68% of cost went at the time the service is provided, but then you get an enormous check at the end of the year that sometimes is almost as big as what you got paid all during the year on the Medicaid. But the doctors and the clinics and those kind of people, that they only get the first check. And so they are the underpaid in Medicaid, typically not the hospitals are the ones getting the supplemental payments. They will still say they're underpaid, but they're dramatically less underpaid than the other providers. So I do think that figuring out how to get those providers better paid is an important and necessary task.
Mm-hmm.
But I just think it's also important, members, that we separate those two. Anyway, all right, thank you.
Thank you very much.
All right. Does anyone want the resource witness, or all right. At this time, there are no other witnesses signed up to testify. Is there anyone else wishing to testify on, for, or against House Bill 5023? Seeing none, public testimony is closed, and the chair recognizes Representative Garrett to close on House Bill 5023.
Chairman, I believe we have a resource witness here,
Yeah.
and I would encourage
Yeah.
the committee to listen to the resource witness.
Okay. Well, I guess we asked about the resource witness and whether or not anybody wanted them, and I think there wasn't a desire on the committee, but we can certainly get with them afterwards. You said a resource witness. You have somebody with the agency, right?
Yeah.
Yeah. And I think we're good.
You're good.
We're
Very
good.
good. And, Chairman, I've known you a long time, and I've known many of the members here. All we want to do is again, just do the right thing. That's what we all want to do. And so I think that it's important that we look at these issues, and we're definitely agreeable to, and we are in discussions with the organization. And with that, I close.
All right. Thank you very much. If there's no objection, the bill will be left pending. The chair is none, and House Bill 5023 is left pending. All right. And as I mentioned, we're going to skip over to Representative Campos. Chair lays out House Bill 4905 and recognizes Representative Campos to explain her bill. And Chair offers a committee substitute for House Bill 4905.
Thank you, Chairman Frank and Vice Chair.
I think if you make sure your microphone's on, or you can scoot up.
There you go.
Try that again.
Yes. Thank you, Chairman Frank and Vice Chair Rose and fellow members. Thank you for the opportunity to lay out House Bill 4905 relating to the definition of a neglect of a child and suit affecting the parent-child relationship, which DFPS is appointed joint managing conservator with the parent. Texas parents can voluntarily terminate their rights, called refusal to assume parental responsibility, or RAPR. Many children with trauma act out, skip school, and use illegal substance to test boundaries or numb their pain. Mental health issues are also involved either with the children or their parents, and comes to a head with a child enters a mental hospital or the juvenile system and the parents refuse to pick them up. Rappers put the court and DFPS in a very difficult position as no statute-defined abuse has occurred. But currently, the judge cannot order a parent to take care of a child they don't want. The state is appointed as Joint Managing Conservator, or JMC, but many families, even after receiving support services, will continue to refuse the responsibility. For those children whose parents refuse services or who fail to unify after services have been attempted, finding a new adoptive family is difficult, and the state is left to prepare for them for adult living. Many of these kids end up being children without placement. HB 4905 seeks to define rapper cases with parents continue to refuse their child, and DFPS is JMC to be defined as neglect in Section 261.001 of the Family Code. Before appointing DFPS as JMC, the court must find significant evidence that the parent exhausted all reasonable means available to them for mental health services for the child. DFPS is able to provide these necessary services and has identified a licensed placement or kinship to meet the child's needs, which cannot be CWAP, like motels. If these and other conditions cannot be met, the court shall order the child be placed with parents until a licensed setting is available or discharge DFPS as the child's JMC and dismiss the suit. The legislator must emphasize parental responsibility and ensure that if parents decide to refuse the responsibility, the state must have the means to do so. These means are not just financial or services, but also a safe place. I am open for questions, and I respectfully reserve the right to close.
Well, thank you, members. Any questions of Representative Campos? I want to tell you, I appreciate you. You know, this has to do with the CWAP issue and trying to come up with some possible solutions. And I can tell you, there are no easy answers, and there are no non-controversial answers when you're trying to address this type of issue. And I appreciate you working with people on it. I hope we can get somewhere that will, make things better, but obviously not just the CWAP issue, because that's not the only issue out there. That's the issue from our perspective, but we've got issue of parents handing over kids. How much should you push them when they do that? So I think there should be, we don't have a ton of testimony, but I think it should be good testimony, and we're also going to call up the commissioner at the end to address it. And but I really would ask every member to, I know we've got some people laying out bills and that kind of stuff, but I know most of the issues we deal with here are tough. To me, this is maybe one of the hardest. So appreciate you jumping in. This is kind of the issue we talked about, I think, on the maybe first or second week, and this is one of the responses to it. So any other questions? That was no question, but any other questions for Representative Campos?
Thank you, Chairman, for that. And again, this stems from the work that I did this interim, working with families, and just, it's a tough issue for all of us, and I know that we're all doing the best that we can for the betterment of our children, so thank you for that.
Okay, thank you very much. Chair, we're going to hear from a couple witnesses. Chair calls Christina Perrone. I get that right? Perrone. Okay, I'm sorry. I've got you as Christina Perrone, testifying on behalf of yourself and the Texas Association of Family Defense Attorneys against the bill. Is that correct?
That's correct.
Okay, thank you very much.
Thank you again, Christina Perrone, and I am an attorney. I work in Northeast Texas, rural counties up in Northeast Texas, and I am intimately familiar with Family Code Section 262.352 in the version that passed previously in 2021. Today, I want to tell you a very true story about some people I know too well and their experience with this bill and what this would have as an effect on them and their family. Candace and Stephen, in 2019, their adopted son, William, was adjudicated of 2 counts of aggravated sexual assault of a child for the sexual abuse that he perpetrated in his home with his parents against his sisters. William was sentenced to 2 years of probation with his county's juvenile probation department, but by November of 2021, William was on his 3rd residential treatment center and Candace and Stephen had paid $5,000 in child support. They had paid $5,000 in attorney's fees for William, and they were continuing to pay for weekly private therapy for their daughters. Despite William's continued need for treatment, probation was ready to close his case, and without an alternative placement, he would be returning home to Candace, Stephen, and his 2 victims. At the time, William was receiving treatment at Pegasus Schools, and as many of you may know, it is the treatment center in Texas for youth who have problematic sexual behavior problems. However, Pegasus Schools takes only just 2 types of children: those who are working with the juvenile probation department and those who are in DFPS's care. Therefore, Candace knew that she would not be able to continue to obtain the treatment that William so desperately needed, and so she made the difficult decision to self-report online as a refusal to accept parental responsibility for her own son. I am happy to tell you that today Candace and Stephen do share joint managing conservatorship of William with the Department of Family and Protective Services. However, had House Bill 4905 been the law at the time, the way it is written currently, Candace and Stephen would have had a dramatically different result. House Bill 4905 would have required that they pay child support and medical support to the department in an amount equal to the cost of William's care. And as a specialized level of care child at a residential treatment center, that would have been $6,000 per month in residential costs alone. Candace and Stephen would have also been required to pay Medicaid costs despite the fact that they provided Blue Cross Blue Shield private insurance for their son. And they had continued and will continue to support William in various other ways, including their visitation trips to see him 5.5 hours away, clothing, school supplies, gifts, and most of his necessities. While that family continues to pay several $100s per month in counseling for William's victims. By including shall in the legislation as written, this bill requires that the court order an untenable amount of child support, and JMC would not have been an option. You ask yourself why that is important, and it is because this proposed legislation also removes an exemption from the definition of neglect for parents who parent these children by saying that unless their case ends in a joint managing conservatorship court order, they could be found reason to believe for neglect. Stephen was a 22-year police officer veteran who worked as a school resource officer at a local elementary school. Had a reason to believe finding been made against him, he would have lost his job, and his family's livelihood would have been at stake because of the terrible choice an 11-year-old child adopted from foster care made. Is this the intended consequence of the proposed amendments? I certainly hope that it is not. But if even just one family suffers this consequence, it's far too many. The relinquishment avoidance program, the RTC bed projects, those things that exist currently are exactly designed for these types of cases. But when we require that these investigations end in joint managing conservatorship court orders, while simultaneously making it impossible for families to achieve them, we've eviscerated those programs entirely. There's more issues with the legislation with respect to DFPS having to find placement prior to a court order.
You can wrap up, please.
When they can't do so until after a court order has been obtained by their current policies. And the department's ability to say that they're simply not able to provide these services leaves people like Candace, Stephen, William, and his sisters without help. So we ask that you do not pass the amendment as written.
Or the bill. Thank you for that testimony. Have you gotten comment? I don't know exactly when the committee sub came. Have you gotten comment? I mean, is there nothing redeemable in the bill? In your opinion, is it just completely the wrong direction, or are there some? I mean, we're trying to address an issue I think you're aware of, and I really do appreciate your testimony. I don't agree with the if just one logic, because frankly, we're not dealing with just one. We're dealing with, we're dealing with thousands of kids around the state. We've got to make the best decision for everyone, and I don't care what you do, you're going to have problems on one side or the other of anything we do here. And so the one matters, obviously, but the policy matters as well. So are there some changes, or are you just saying it's absolutely the wrong direction, we shouldn't do anything in this?
No, I appreciate the question. I think there are absolutely some changes. And with respect to the concern about how do we make this work for a broader number of families in lieu of just stopping the process because one family might suffer, I think having language that leaves some of the requirements to the discretion of the court. The proposed legislation includes language like shall, especially with respect to things like child support and medical support costs. Some of these children are placed on child-specific contracts that cost upwards of $20,000 a month.
It says shall, but there is also wording about indigence. We could probably get that. I mean, I think you could clean that up where it's, a percentage or I think
I think if it was a percentage that was more in line with the Texas Attorney General's, regular percentages for child support and not something that went egregiously above and beyond that, it would certainly be more salvageable or fix that issue with respect to that particular family. Many things in the bill are positive, making sure that these parents actively participate in their children's treatment, making sure that we're finding safe and appropriate placements. These are exactly the children we don't want sleeping in hotels.
Right. So would you be able to get written comments to the bill author, and we don't have much time, so
Absolutely.
really quickly? And then
Certainly, I would love to.
I'm certain that those will be taken into consideration.
Absolutely.
That's all right. I think we've got some nods. I think we know this is an important issue, and I think, honestly, if you're willing, I would love a couple of y'all to be willing to jump in on this and get it written in a way that's agreeable. So thank you very much for your testimony. Members, any other questions?
Thank you very much.
All right, thank you very much. Chair calls Julia Hatcher. And I'll show you as Julia Hatcher testifying for self and Texas Association of Family Defense Attorneys against the bill. Is that correct?
That's correct. Chairman Frank,
Yep.
committee members, my name is Julia Hatcher. I'm an attorney in Galveston. I'm also the president of the Texas Association of Family Defense Attorneys, and we are against this bill. TAFTA has attorneys all over the state who represent parents in these dire situations. We found that the caseworkers have either never heard of the JMC program, they think it only applies to post-adopt kids who are coming back into care, or they just don't want to deal with it. But the legislature put the JMC program into effect for a reason. It was to help parents and children, not hurt them. A group of our members recently approached DFPS, and we actually had 2 meetings with leadership, including the commissioner, where we shared personal stories of what is happening around the state with these kids. It's not just one. It's not just one kid. It's not just one family. It's happening all over the state. For instance, I represent a mom who refused to pick her child up from a psychiatric hospital after the child had assaulted her and her siblings because the mom knew what was best for her child, and that was for her to be somewhere where she could get the help that she needs. She requested the doctor at the psychiatric hospital to send a referral for the child to an RTC, which he did. This was the 12th time that the child had been in a psychiatric facility in the last 6 years. She had recently completed juvenile probation for assaulting her mother and her brother, and my client had asked juvenile probation at that time to help her. They called DFPS, and there was a huge meeting at that point. The mother said that the younger children had made outcries of sexually inappropriate touching, but because there was nothing specific that was said, DFPS did not investigate it, and they sent the child back home. These kids are facing revolving door situations. It was not a month later before this child ended back into a psychiatric hospital. These children get stabilized with medicine at a hospital, and they say, okay, they're ready for discharge. They get out. Within a month, they're back in. We need to start helping these kids. This is a cycle that needs to be stopped. You're all wondering probably what happened to my client's child. Well, DFPS didn't believe us when we said that it was a child who needed help. They wanted to blame my client. That's the easy thing. Blame the parents. The parents aren't raising their kids correctly. Okay, well, this child had been in counseling through the LMHA since 2016. She wasn't getting the correct counseling, obviously, because nothing was helping. She was attempting suicide. She was running away. She was cutting herself. So we went to court with about 2,000 pages of mental health records. Unfortunately, the judge sided with DFPS, did a removal action so the state could have custody, and the state placed my client's child with her aunt over my client's objection, and guess what? The child ran away within a month, cut herself, and ended up back in a psychiatric hospital. She was psychologically evaluated and then placed in a temporary emergency shelter where she remains today because nobody in the family will take her into their home because they're all afraid of her. These are real problems with children, and these children need help. But the fix is not to make the JMC program so onerous that nobody can get into it. The most concerning issues that we have are with subsections 2 and 3, because DFPS can just say, oh, we don't have the services, we're not going to take responsibility. Anyway, that's about all I have to say. If you have any questions, I'd be happy to answer them.
Yeah, thank you. I guess it would, almost the same question. If you could get the specific comments, if you feel like some of the direction is good, but you have concerns, if you can get those in writing really quickly to the bill author, that would be really appreciated.
Okay.
And I do think there's I do think there's a bigger issue. I think to some degree we're also asking DFPS, who's used to looking at abused children, to also take care of this same type of child, which is to me almost in a different category. But I'm not sure that's not going to be something we address in this bill. So, members, any questions of Ms. Hatcher? Thank you very much for your testimony, and really would appreciate your feedback to the bill author. All right, Chair calls Stephanie Muth. I show nobody else wishing to testify. I've got you. Thank you, Commissioner. I've got you as Stephanie Muth, DFPS resource only on the bill.
Good morning.
Correct?
That's correct. Stephanie Muth, Commissioner at the Department of Family and Protective Services, and I'm here as a resource. I'm happy to answer any questions, and also I'll just provide a little bit of context. Chair Frank, I think, had approached the agency even prior to me starting. We have an issue, and I think the witnesses before did a very good job of explaining systemic issues that we're facing in Texas, and I think this is a policy issue for consideration by the legislature on what the role of the Department of Family and Protective Services is in these instances. So as you all know, we are struggling with children without placement currently. We have about 70 to 80 kids on any given day that are housed in unlicensed settings. That's a very difficult situation for those children. They're not getting appropriate services. Some of them are coming out of psychiatric hospitals. They're decompensating in those hotel rooms. It's not a good situation for the child. And then also our staff are put in, have overtime. It's an incredible strain on them. They're put in unsafe situations. So, I think it's important for the legislature to have the policy discussion around what the problems are and what the appropriate solutions are. So, we had provided some suggestions, understanding that this would be a conversation, but at the request of the chair and with Representative Campos as well. So happy to answer any questions.
Members, any questions? So I appreciate it. I will just say, I know you've been on board 3.5 months?
Something like that.
No, and honestly, I have already found just a lot of different solutions. I don't agree with all the solutions, but you're coming up with the solutions to systemic problems, because there really are. There's a lot of things to address. This one, I don't think we have a full handle on, but I would. I know Representative Campos, and I'm hoping Representative Ramos is nodding her head. I'm hoping can work towards getting something on this. I think we need to look at how kids are coming in this particular way, because to me it is a lot different than abuse situations, and the solutions are different. And yet I think we're trying to shoehorn them into that same system. Do you? And I'm going to get to a question. So do you? Do they go through the same system in a relinquishment? They can't really, because there's no abuse alleged in a refusal to accept parental responsibility. What is the process? Does it go to a caseworker immediately? What is that process?
If you don't mind, Chairman, with my 3.5 months, I'm not sure I can fully describe that process, but we do have another resource from the department here, Marta Talbert, who can answer that.
That would be great, and I appreciate that. So Chair is going to call Marta Talbert, and thank you, Commissioner.
I'll stick around.
Stay close. Thank you. I've got you as Marta Talbert, DFPS resource on the bill. Is that correct?
That's correct.
All right, thank you. So the process when you get a refusal to accept parental responsibility, the wrappers that we talk about, how does that process, or is it the same process, or it's got to be a different process, I guess, than the normal one, or tell me.
No, it's the same process. It's assigned to an investigator. At that time, they complete an investigation, gather information, and if it ends up being a wrapper, either TMC or JMC, it goes through the same process of us filing an affidavit, going to court. It'll be the exact same process.
Because you're almost never going to, yes, please, thank you. Representative Ramos, thank you.
Thank you, Chair. Going along the line of what the question that he just asked, so in my personal I have a little neighbor, and I think about the cases that you were referencing. I have a little neighborhood child who comes to my house and has some mental issues, and beautiful child. She's enormous. She's taller than I am, and the parents are doing everything they possibly can, but when she doesn't take her medication, she'll come to my house and cry and, call the police, and there's no abuse. There's clearly no abuse, but she didn't take her medication, and once she does, I kind of dig through, but as teenage kids, they'll tell you a little bit and they'll stop. So there is no abuse in terms of, something to call CPS and whatever. And the parents are doing everything they can. She's refusing to take her medication. This child is 6 feet tall. She's a big little girl. And so in this situation, it's not calling CPS for abuse or neglect because this child is just a big little girl who's a teenager but when she doesn't take her medication, she kind of goes off the rails. And so right now she's in a space where they're providing support for her mental health issues, but it's concerning to me that the parents have been doing everything they possibly can to care for this child and trying to find the right spaces for her to put her in a home, and it's very expensive, and these are working middle-class families. And so in this situation, getting CPS involved, it's not child abuse or neglect. So at what point, or in this situation, you said it's exactly the same. In this situation, the way the bill is written, the department would have JMC over this child, even though these parents have done everything they possibly can to help this child. How does that fit into this space in terms of bringing the department or involving the department in this personal family situation where their parents are absolutely doing everything? It seems like it's almost punitive, the way it's written. Or could you speak a little bit about to that?
Yes, I think I'll start kind of from the beginning, because when people call statewide intake, they're calling because of concerns for abuse or neglect. So it starts there with those worries of abuse or neglect. We shouldn't get phone calls or referrals into our system if it's not concerns for abuse or neglect. So I think it starts there, and anything we do goes to an investigation, right? So it's going to come over to investigation for us to determine if there is abuse or neglect. So there's a suspected abuse or neglect, call it in, and then we work the investigation. I will say the difference sometimes is that if we disposition or not, right? So
if you what? I'm sorry?
If we disposition a
Disposition,
case.
thank you. I just
Right,
couldn't understand
so
the word.
in that certain circumstance, if we end up being involved with that family and we are trying to help and do resources, maybe there's not an actual RTB, but the process will be the same coming through our system.
Anything else?
Yes.
If you don't mind,
Actually, so Commissioner Muth, go ahead. I just want to
Yes.
just identify yourself. Since y'all are both resource
Yes.
witness, just before you talk, and just identify who's talking.
Stephanie Muth, Commissioner at the Department of Family and Protective Services. And I just want to add, I think that's the complexity of this issue, because the problem for the department is that we also don't have the ability, if there is not an appropriate placement for the child, and that's the issue that we're struggling with right now. Our caseworkers in a hotel room are not any better able to provide those appropriate services than a parent. And so it's not a situation with an easy answer on one way or another, but that's the struggle that we're having as well, in that we're exhausting efforts to attempt to find appropriate placements. And there is work that's being done to increase capacity within the system, but where we are today is that every night there's 70 to 80 children that we do not have a placement for, that are staying in unsafe situations, and some of them are there for a period of time. I mean, and it's not we have security. It's not that it's an unsafe situation, but often, like I said, they're coming out of a psychiatric hospital, like in some of those situations that were described. They're decompensating in a hotel room. It is not an appropriate placement for the child. So I in no way want to minimize the complexity of the issue. It's just that there's not an easy answer for on our side or for the parents.
Yeah, Representative Ramos.
And I appreciate your honesty, and that for me is the concern of why I haven't called CPS. In another universe, somebody may say it's neglect, but I know the parents are doing the absolute best they can. And when she doesn't take her meds, she comes to my house at 10 o'clock at night crying. I contact the parents and they come pick her up. And so I can see, I would be terrified if this baby girl got involved in became one of those cases, because I appreciate the honesty and that the department can't do what her parents are doing everything they possibly can do. And so it is a terrifying situation for these children, but something that we absolutely need to address. And so I appreciate Representative Campos for trying to do something to fix this situation, because we love our children and want to make sure that they're in the best space. But sometimes if the parents are doing the best that they absolutely can, I would just hate to put them in a situation that it's a bind for them as well. So thank you.
Thank you very much, Representative Campos.
Yeah, so I just wanted to talk about one situation, because I do appreciate what the witnesses are saying, and I completely understand, but there's just all types of cases, and so we're all just taking baby steps and trying to collaborate and do the best that we can. But there was one case where CPS was called, and on a little girl, the mom, and then the mom just said, I don't want to deal with her, send her to dad, but CPS was already involved. One thing led to another, and she had a lot of mental illness and winded up running in the middle of the street. The caseworker chased her down. Both of them almost got hit by a car. So I've seen so then we got to take care of the investigators or caseworkers. We got to take care of the kids. We got to help the parents. So it's a huge issue that we just got to dive into and just do the best we can, because it's really tough when you talk to the investigators and they tell you the stories that they've been through with these children that have mental illness. I mean, there's been a caseworker that was beat. There was another one that was sexually assaulted. I mean, there's just all type of cases, and so we're all just trying to do the best we can. And so thank y'all for working with me on that.
Thank you.
Thank you. Just one more question. So 70 kids or so, and I haven't seen the numbers in a couple months, but it seemed like they were less than 20 days on average. It was a fairly short, too long, but fairly short amount of time. Is that about right? But anyway, well, but it's a fair. But regardless of the length of time, it is pretty temporary. Where are they going from there?
So we've been
Commissioner Muth.
Stephanie Muth, Commissioner at Department of Family and Protective Services. So we have been really looking at the situation from both individual children and trying to find the appropriate placement for those children, but then also from a systems perspective, what are the trends? What do we see? And there are some children that are without placement for a short period of time, and typically then, I mean, we are trying to find a kinship placement, whatever, if there is a therapeutic foster home, a residential facility, we will look at all options for those placements. We also have some children who end up staying for much longer periods of time, and unfortunately, in some situations, they end up aging out of foster care while they're so there's a number of children that are 17 or older who are in that situation, and they may be there for months, and then they end up aging out of foster care in that setting.
All right, thank you, members. Any other questions? I warned you at the start. This is not the easy. I mean, most of the bills we have are hard. This one is one of the hardest. So thank you very much, Commissioner and Marcia. Thank you very much. Chair calls Maureen Ball. Chair calls I'll show you as Maureen Ball, self against the bill. Is that correct?
Yes.
Yes, that's correct.
Okay, thank you. And I show nobody else wishing to testify on the bill, so if you are, please get registered. Go ahead.
Yes, Maureen Ball, self. I'm an attorney that I represent parents and children in CPS cases. So I've actually represented a child that went through a situation like this that had a mental health problem that her adoptive parents were having a struggle dealing with, and she ended up in one of those hotel rooms. And there was a struggle finding her facilities. But the goal was to get her mental health services. And that's why government exists. That's really why CPS exists, to help these children and these parents who are struggling in a situation. So the remedy is not to vote for this and put more burden on the parents to pay for something that they can't. You know, if they could, they would, but they can't. So they're calling CPS to say, you guys are the experts. You're supposed to be the experts. You're supposed to know where to place these children with mental health problems. You know facilities. You've got contacts in these facilities. You can break through the bottlenecks that I'm having as a parent. So I strongly urge you to not pass this bill. There are things that need to be done for the children, for the foster care children and the parents, but this bill doesn't do it. So I'm speaking against this bill.
Okay, thank you very much. I'm going to ask the same question, and I'm not trying to force a bill, but I think the prior two folks that were attorneys were also saying there are parts of this that actually are positive and parts that are very negative, and you're testifying against. Is it the whole concept of the bill is bad, or are there specific parts of the bill that if they changed, could we get there?
I don't have the bill in front of me. The one that really stuck out to me was requiring the CPS to have a facility before they will accept the case. And that just doesn't really happen. I mean, they have to go through the process. There's forms that you fill out and all that. And so the parents are in distress. They need help immediately, whatever that help looks like. And that's what we're all struggling with, is to improve the help that they can get immediately. The second thing is requiring these parents, adoptive parents primarily, I think, but nevertheless, requiring them to pay for these services. I mean, it's not fair to our community that we dismiss a child from services because the parents can't pay for it, and then the child ends up having severe problems that we see all over the news. And everyone's like, how come someone didn't do anything about this before they had a very serious problem? This is parents looking for help to eliminate the child from getting into serious trouble and harming themselves or others.
Okay, thank you. Members, any other questions? Thank you very much for your testimony. At this time, there are no other witnesses signed up to testify. Is there anyone else wish to testify on, for, or against House Bill 4905? Seeing none, public testimony is closed, and the chair recognizes Representative Campos to close on House Bill 4905.
HB 49 will lower the number of children without placement, which is a huge issue that we hopefully can eliminate and get the children the help that they need. And with that, I respectfully ask for your support. Thank you, and I close.
All right, very good. The committee substitute is withdrawn, and if there's no objection, the bill will be left pending. The chair hears none, and House Bill 4905 is left pending without objection. Stand at ease for just a minute. What's that? I'm going to try to knock out one more bill before the floor. Chair lays out House Bill 4956 and recognizes Representative Shaheen and his one witness to explain his bill.
Thank you, Chair Frank.
The chair also offers up a committee substitute for House Bill 4956. All right.
Thank you, Chair Frank, Vice Chair Rose, members. So House Bill 4956 is about increasing transparency and the effectiveness of DFPS by requiring key information be published monthly instead of annually. With the shift of responsibilities falling more and more on community providers, it's important to ensure that there is access to the most relevant data in order to better understand what is working and what isn't. So House Bill 4956 seeks to ensure important information is made publicly available in a more timely manner. So again, we're talking about the reports that are currently produced annually. They would be produced monthly. The type of reports we're talking about, the type of reports that we're talking about are the number of child abuse, neglect, or exploitation reports, average time to process an electronic report of child abuse, the average hold time for a call to the department's abuse hotline, call abandonment rates. The average time to process an electronic report of child abuse, the average hold time for a call to the department's abuse hotline, call abandonment rates. The average time to process an electronic report of child abuse, the average hold time for a call to the department's abuse hotline, call abandonment rates. There's also a provision in the bill that would allow DFPS to contract with a third-party entity to help them collect, analyze, and report the data, should this be something that they need to take advantage of that. With that, Mr. Chairman, I'm happy to answer any questions and reserve the right to close.
All right, members, any questions? So, do you know, Representative, what of this information is not already available? Because there's a website that is pretty good. I mean, actually has great information, but incomplete information on it.
Yeah.
For DFPS.
Yeah, so we work a lot with DFPS. So we made sure every report listed here is they're reporting on it today, and they're doing it annually already. And so we had a discussion with them saying, you're providing this today and annually, can you do it monthly? And so that's what this represents. We work really closely with DFPS on
Okay. Terrific. Thank you very much. Members, any other questions of the representative? All right. Chair calls Carrie Judice. Did I get that right? Judice? Judice. Carrie Judice with Text for Text for the bill. Is that correct?
That's correct.
All right. Thank you. And I should know anybody else. There's a number signed up for the bill, but no one else wishing to testify. So if you do want to testify, please get signed up. All right. Go ahead, ma'am.
For me? All right.
Yep.
Chair Frank, members, thank you for the opportunity to provide testimony in support of House Bill 4956 by Representative Shaheen. My name is Carrie Judice. I'm the Child Protection Policy Manager at Text Protects. And Text Protects is the only statewide organization in Texas that's focused primarily on the prevention of child abuse and neglect and the aftermath in its absence. We're also proud to be the Texas chapter of Prevent Child Abuse America and a lead advocacy organization for the Child Protection Roundtable. So at Text Protects, we want to ensure children and families are safe and healthy and that children are protected from abuse and neglect. And to make sure this happens, real-time data must be part of the equation. DFPS and community providers are making life-changing decisions for children and families. And so having access to more frequent data can be the difference between a family receiving supports that they need to remain safely together versus a removal. For kids in care, being able to identify where a problem exists and maybe when it started could be the difference for a child achieving timely permanency. So a rider was actually passed last session, so Chair, to your point. It actually directed DFPS to update and publish critical child protection information monthly on their website. This information includes those volumes of reports to statewide intake, number of stages open and closed in each stage of service, and it also includes timeliness of investigations. And so we've really heard a lot from stakeholders in the interim how helpful this has been to have this information on the website. And this bill would codify that into statute to ensure this information continues to be available monthly. The bill also does go a step further and require a few additional metrics that are already collected by DFPS, and those would be published monthly as well. Based on recent discussions, I think there's actually a few metrics that this committee would be interested in knowing that the bill includes. So Chairman Frank, this would require to publish the reason for removals. So, you know, the difference between abuse and neglect in order to provide a better understanding of what kind of issues are leading to children coming into care. It would also differentiate the data between family-based safety services and court-ordered services, where those Texas Family First pilots are offered. And, you know, we've listened to this committee's discussions, even just last week, that was talking about the difference between, you know, mandatory reporting and supporting. And so another thing that this bill would actually offer is breaking down those statewide intake referrals and kind of showcasing where those information and referrals those are the referrals that actually are just meant to be community referrals to providers. And so I think that would be helpful for this committee to have as well. And last but not least, obviously, community-based care. We have more areas coming online, and this would actually require those measures to be available more frequently. And so, you know, this committee, y'all have really shown a desire for transparency, accountability, and effectiveness at DFPS, and really this real-time data that House Bill 4956 would require helps us get there. And so, again, thank you, Representative Shaheen, for filing this bill, and we just ask for your support.
All right, thank you, members. Any questions? Thank you very much for your work on this. At this time, there are no other witnesses signed up to testify. Is there anyone else wishing to testify on, for, or against House Bill 4965? Seeing none, public testimony is closed, and the chair recognizes Representative Shaheen to close on House Bill 4965.
Thank you, Mr. Chairman. I close.
I think Vice Chair had a question for you, though.
Oh, I'm sorry.
So let's withdraw the close.
I withdraw my close.
Vice Chair Rose.
Representative Shaheen, since you're increasing this to monthly, is that increasing government or expanding government?
No, ma'am, it is not. The role of government does not expand. However, it does provide additional transparency, and I look forward to you join authoring this bill.
Well played. Well played. All right. Oh, my. Representative Shaheen.
I close.
You're close. The committee substitute is withdrawn, and if there is no objection, the bill will be left pending. The chair hears none. And House Bill 4965 is left pending without objection. Chair. Sorry, let me try that again. Yeah, the chair, sorry. The chair hears none, and House Bill 4956 is left pending without objection. All right. The chair moves that the committee stand in recess until final adjournment or recess of the House or during bill referral if permission is granted. Is there objection? Hearing none, the motion prevails, and the committee stands in recess.